Breastfeeding is an instinctive process and it happens very naturally. But in the present day circumstances, it seems to be a big burden for the young mothers because they don't seem to have enough support. It has become a norm to be more of a nuclear family rather than a joint family like in the past. So many of them are misinformed or misguided, and they do not know the correct methods or the positions or how the breastfeeding has to be gone about. So I'm here to tell you a few facts about the breastfeeding and to bust few myths which are going on in the minds of most young mothers. See, first of all, most people think that the milk will flow in only after the baby is born. It is not so. Right from when the woman is 36 weeks of gestation, if the intrauterine gestation, milk production starts, and it will start happening. It starts even earlier, but right from 36 weeks of gestation, milk expression can happen and the mother will be able to secrete the milk. So most often we here in SIMS hospital also do an antenatal education to the mothers to aid them in breastfeeding postnatally so that they are prepared as to what to look for and how to handle the baby and all those things. So the lactation management clinic at SIMS hospital helps the antenatal mothers to get prepared for their feeding their baby postnatally. So postnatally what happens, within 1 hour we ask the baby to be put to the breast in order to suckle. The reason for this 1 hour is that is the time when the baby is very alert and looks around, and a great amount of bonding between the mother and the baby can happen. So as the bonding happens and the baby suckles at the breast, the mother is able to let down more milk. There is this hormone called oxytocin, which is a let down hormone, and as the milk comes in, the baby also suckles and it's able to take the feeds. So that 1 hour is crucial, and that's why we say within the first hour, the golden hour, which the baby has to be put to the breast, and it is not. And also the skin to skin contact with the mother helps the mother and helps the mother to secrete more milk, and the baby also feels very comforted. And beyond that, we also say the baby has to be fed initially at least every 2 hours. The baby has to be put to the mother's breast so that the more suckling happens, the more let down of milk happens, and the baby gets the required amount of feeding. See, there is a common myth that the not enough milk comes in. Yes, it is nature's design that the first 2 to 3 days there is only what is called the colostrum, the milk which comes in, which is maybe a little watery, sometimes a little thick, but it comes only in few drops. So there is this common misconception, only few drops are coming, the baby is going to be hungry, the baby is crying, so why not we give something else? So we do not recommend that, because the colostrum, though it comes in few drops, it is calorie dense, is quite high, so which is sufficient for the baby within the first 2 to 3 days. Beyond the second day, there is more milk which is being produced for the mother, which will give more satiety to the baby. So even in the milk that is produced, there is what is called the foremilk and the hindmilk. So the milk which comes initially is a little watery. It may be a little light yellow, it may be more yellow, it could be in different colors, it could be light blue also, sometimes it could be a little brownish, sometimes if there is any crack in the nipple or there is any ectasia of the duct which happens. So these different colors, it does not mean that there is something wrong with the milk and it need not be discarded. All this milk can be fed to the baby. So the initial milk, foremilk which comes in, is little watery, that is helps to quench the thirst of the baby. When the baby is hungry and starts crying, so the first taking the foremilk will quench the thirst. Then what comes beyond is called the hindmilk, which is richer in the proteins, fats, minerals and various other things, which helps in the satiety of the baby. So that is why we say roughly a baby should feed at the breast for almost 15 to 20 minutes, because initially it will be the foremilk and then only the hindmilk will come. So only when it completely takes for 15 to 20 minutes, it would like taking a whole meal, and the baby feels satisfied and sleeps well, and it also is able to gain more weight. So sometimes if you only give for every 5 minutes, the baby will be only taking the foremilk. So the baby may not put on weight, and it will be just passing a lot of stools which are very watery and very soundy stools also. So, and there is not enough weight gain. So which means there is a little fault in the feeding, and we have to help and educate the mother to tell her how to give the both foremilk and the hindmilk. And again, the positions, the latching and the position is very important. Latching is where the baby is holds on to the mother's breast. So the mother's breast usually enlarges during pregnancy because of the growth of the tissues and the production of the milk and the milk ductules. The baby has to be latched onto the breast, then open mouth, lower lip touches the breast, and the upper part of the mouth is open and covers most of the nipple and the areola. Some part of the areola may be exposed. That shows a good latch. So only if the baby latches on to the part of the nipple and part of the areola, it's able to get a good grip. And then, because breastfeeding is an active process, it has to suckle and withdraw all the milk from the lactiferous ducts and the ductules. So if that is a good position, the baby will be able to do that. If it does not latch well, the mother will get a little pain and crack in the nipple. The baby may not get enough feeds, just nibbling at the nipple, and get frustrated and start crying. So the whole experience becomes very painful, and then the young mother, instead of enjoying her baby, gets very frustrated, and everybody around also keeps saying, oh, there is no milk, we are not able to feed, and all that. So to avoid all these things, only preparation and education of the young mother is very much important. And the other problem which happens is when the cracked nipple happens, which happens only because of faulty latching, they try to give other things like put on nipple shields or other things, which are to be discouraged, because then the baby will not latch on properly and take the feeds. But what can be done is, and if the baby does not feed well, the mother can also have an engorged breast. More of milk is accumulated in the breast, then she gets a heaviness, she gets pain, and sometimes a lot of tenderness and fever also. So we should not allow this to happen. So if that, in case it happens, the mother can be given some warm compresses on the breast, and she can be allowed to either express the milk manually or using a breast pump. The milk which is expressed can be stored in sterile containers in the room temperature easily for about 6 hours, and in the fridge for about 24 hours. So that can be given by a small cup or a palade, what we call, to the baby, and the mother can be allowed to take rest. Because most often the babies are very active during the night, and they do go to sleep during the day, because in a 24-hour period, almost 18 hours the babies will be sleeping. So only when the baby goes to sleep can the mother also take her rest. Because if she's not going to rest, then it will be like, she's working 24 hours and she's going to get very tired. So that is why we advise breast milk can be kept and stored in sterile containers and can be given by the palade or a cup when the mother is taking some rest. So all these will help in trying to give exclusive breastfeeds for the baby, which is going to be of a great benefit for the growth and the well-being of the child in the future. The other thing which commonly happens is, lying down and feeding. So we tell most of the mothers, don't lie down flat and feed. That's because, again, the position will not be good. The baby may not latch well. Plus, if there could be some middle ear effusion and other things, which is not it's not a very good position for the baby to feed. So either a semi-reclining position or a side-lying position is recommended. Otherwise, there are various other positions which are there, like a cradle, the cross cradle, and the football hold, which we teach the mothers in the antenatal period even, or even postnatally, so that whichever is comfortable, they can hold the baby in that position and then feed. The other common myth is, if the mother is not taking any food, she's not going to get any milk. That is not at all true. Like I said, it is nature's design that the first few days, only few drops of milk comes, and then there is what is called the transitional milk between 4 days to 15 days, and then the mature milk comes. So whether she eats or not, she will be producing the amount of milk required for her baby. Yes, about 85 to 90% of breast milk is water. So the mother does need to take a lot of liquids, and with her taking more liquids and the baby suckling frequently at the breast, she will be able to put out more milk. And then, of course, she must take a balanced diet which contains of everything: proteins, carbohydrates, fats, minerals, and vitamins. So if she eats healthy, she is going to produce healthy milk which the baby can take, and then the offspring will also be healthy. So these are some of the common myths which are there, which I've tried to bust. For any more things, you can contact us at the Lactation Management Clinic of SIMS Hospital, Vadapalani. Thank you.